Okay, today's one is something I've been preparing for quite a while, and I believe that it is going to cause a little bit of controversy. But that is the whole idea, because I want to know your opinions. But first, I'm going to give you the facts. This one is about the American healthcare system, but also the United Kingdom healthcare system. So we're going to do a comparison, and I'm going to tell you how the UK system works and how I think the US system works, because I have been trying to work this out and have researched the US health system, and I just can't get my head around it. It's just okay. Let's start with the UK. This is the one I know about. In the UK, first off, I'm gonna have to tell you that we don't pay for some things, but we do pay for others. So for any person who doesn't get the UK health system, you all seem to be under the impression that we don't pay for anything, and we're just like, no, don't have to pay. But that isn't strictly true. So the things that we have to pay for in the UK are prescriptions, you know, for tablets, you know, drugs, and optician and dental surgery. A lot of you are going to go, well, why is that of any benefit? These things are kind of the routine things. The drugs, I understand people are going to go, well, if you need drugs, you need drugs, and you're not going to, you know, buy them if it's not necessary. But they need funding for those pills, so they have to get you to pay for the prescription to get the funding. The optician and dental services are different. These are like the essential, not essential, no. These are the things that you can opt out of. So, for example, you don't have to go to the dentist and have your teeth checked. No. Not if you don't want to, but it is a good idea. So a lot of people do. But they have to pay a small amount to that service. Same with your eyes. You don't have to go and have your eyes tested unless you think that you're going blind. I mean, you still might not want to have them tested, so you're not losing any money. But it's a great idea to have them tested. So you have to pay a small amount. But things like open heart surgery, operations caused because of accidents, and things like that, they do not have to be paid for by us. Because if, for example, I needed to go into hospital and have surgery that cost £5,000, and if I didn't have the surgery I would die, but I didn't have the £5,000, I can't really go in for that operation if I have to pay for it, because I haven't got the £5,000. So I die, basically. And we've also got a private sector. And now you're all going to go, you're confusing us. This is quite simple. You pay out the nose for quality in the private sector. For example, you can pay over £100 for a routine checkup at the dentist in the private sector, whereas in the NHS sector you can pay £15. So there is a big difference. You do the math, I can't do math. And they are optional, you don't have to be with them. So most people choose to be with the national healthcare system, because the private sector is really for the rich people who have got money to burn and just think, right, I'll go to the private sectors. I mean, why they don't just give the money to me that they want to burn? You know, I'll take any money, you know, but and also the private sector is if you're very desperate. So for example, if a woman wanted to go through IVF with her partner and couldn't get that IVF on the NHS for I don't know, 10 years or something, from when she applied for it. I don't know whether you apply for IVF, but I don't know how these things work. Don't start a debate about this. Then she could go to the private sector and pay more to have the IVF. But now we're going to move on to the US healthcare system. Now, please let me know if this is wrong, because I have no idea how the US system works. Okay, the way I've kind of pieced it together, if you like, is that if you're in the NHS, why do I keep saying NHS? If you're in the US, you have to either be rich or have the money to buy health insurance. So you either have the money to pay up front, or you have health insurance to pay it for you. Either way, I believe that when you go into a surgery or something, the first thing that the receptionist or doctor is going to want to see is your credit card. If you don't have cash or credit card, you turned away, gone. It doesn't matter what illness you have. You could be dead in 59 seconds from when you walked in. They couldn't care. If you haven't got the money, gone. And please, Americans, don't shout at me for this. I don't want to fall out with you guys. I love you all, but this is the way I'm seeing it. So if you haven't got the money to pay health insurance, and you haven't got the money to pay for the surgery that you need or could need, then you just pray to God that you will never need to go to the doctors, or that the death that you have will be quick.